Hi, my name is Serena and welcome to my channel. While the main focus of my channel is samba dance and getting ready for Carnival, I also want to cover topics that are health focused and discuss how dance can help improve your health and enrich your life. In this video, I'm going to focus on cardiovascular health, also known as heart health. February was Heart Health Awareness Month, and as that comes to a close, I wanted to honor that and spend some time to talk about heart health, its risk factors, and some things that you can do in your life to improve your heart health. Now, a disclaimer, this video is designed for educational and/or informational purposes only and should not be used in any other manner. This information is not intended to substitute informed medical advice. You should not use this information to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. A consultation with your healthcare professional is the proper method to address your health concerns. And I encourage you to consult with your healthcare provider with any questions or concerns that you may have regarding about your condition. All right, let's get into it. So why are we focusing on heart health? Why does heart health get its own awareness month? Well, cardiovascular diseases, so diseases of the heart, like stroke or ischemic heart disease, account for the most global deaths and the greatest amount of overall disease burden, called disability adjusted life years, also known as DALYs. Now, DALYs are a measure of overall disease burden, and that is expressed as the number of years lost due to ill health, disability, or early death. And the sooner that we're aware of what puts us at risk of having heart health issues, the sooner that we can make good decisions in our lives to prevent any issues down the line, whether those are issues like having high blood pressure, having a stroke, or a heart attack, so that we can live a long and happy life. A little bit about me. For the past almost 5 years now, I have been working in public health research, and one of the areas that I focused on is heart health. I hold a Master of Science in Epidemiology, which is the study of diseases, how they affect different groups of people, and why. So I'm really passionate about this topic. A new study titled The Global Burden of Cardiovascular Disease just came out in a major scientific publication called the Journal of the American College of Cardiology, which estimates the global burden of heart disease and its risk factors from 1990 to 2022. I'm going to talk about heart health globally in this video. And one of the main findings of the study estimates that the age-standardized cardiovascular disease, also known as CVD, mortality per 100,000 people, is affecting all countries around the world. The age-standardized value, whether it's for incidence, deaths, or DALYs, or any other measure, is the weighted average of the age-specific rates per 100,000 persons, where the weights are the proportions of persons in the corresponding age groups of the standard population. And we can see by this map the estimates that all countries around the world are affected by heart disease. So this doesn't only affect one region in the world or one country. One of the other main findings of the study estimates the age-standardized DALYs per 100,000 person. And this figure from the study shows that the age-standardized DALYs per 100,000 person across all global regions for the different cardiovascular diseases, which make up the condition cardiovascular diseases. So we can see from this figure that ischemic heart disease is the disease that makes up most of the overall disease burden across all regions of the world. Now, this figure also highlights the three main risk factors that significantly contribute to the disease burden by disease. So we can see that the metabolic risks include high systolic blood pressure, high LDL cholesterol, high body mass index, BMI, high fasting plasma glucose, and kidney dysfunction, and the behavioral risks such as dietary risks, and those are defined as diets having diet low in fruit or legumes, or having a diet high in red meat. Behavioral risks also include smoking, high alcohol use, and low physical activity. And in addition to the environmental risk factors, The metabolic risks that are listed and the behavioral risks significantly contribute to the overall disease burden of cardiovascular disease. And this figure from the study shows the disease trends over time for key disease measures, including prevalence, mortality, years lived with disability, also known as YLDs, years of life lost, also known as YLLs, and the value we already talked about, the variable called DALYs, which is the summation of YLLs and YLDs. Across all measures, we can see that the age standardized value has been reducing over time. And looking at years of lived with disability and prevalence specifically, which in this example, prevalence is defined as the number of cases of those with cardiovascular disease present during a particular time. And we're looking at per year. We can see that the age standardized value has been decreasing slightly over time, but now it's flattening out. And in contrast, the all ages prevalence rate per 100,000 has been increasing over time. So what does that mean? That means that those with heart disease across all age groups has been increasing year over year. Now looking at YLLs and deaths, so mortality, we see that these two measures follow a similar trend where the age standardized rate has gone down over time. And the all ages line has remained pretty flat, so there have not really been a significant change in trends for that measure. What does this mean? This means that when looking at the age standardized values, the global population is dying less from cardiovascular disease. I'm going to link the study and other resources below in case you want to look more into this on your own time. Another topic that I wanted to talk about is the relationship between heart health and mental health, specifically depression. Recent studies have started to research the two areas of disease having what's called a bidirectional relationship, where these two variables and these two areas of health actually impact each other. And this is clear over time how they can impact each other. It can lead to more heart disease or worsened mental health. So having, let's say, increased depression. A systematic literature review came out in 2022 and it found that a bidirectional relationship may exist between depressive symptoms and cardiovascular health. The study listed that further research is required to quantify the risk and also identify the different biological mechanisms which underline that association between depressive symptoms and having unfavorable cardiovascular health, so having cardiovascular diseases. The study also listed that this would help for adequate screening and interventions can start to be directed towards people with depressive symptoms or having cardiovascular disease. An example of this is after a cardiac event, like a heart attack, there is a proven pattern of increased prevalence of depression. So there's a proven pattern of somebody having depression and living with that and having that affect them. This is a figure from a study that I've linked below that outlines that bidirectionality between depression and health outcomes, also known as sequela, of chronic heart failure. I plan to cover this topic in more detail in the future, so stay tuned for that. While these numbers may be a little scary, we have the power to change this. One of the most important things that you can do to help prevent from heart disease is to get up, get out, and get moving. Research shows that aerobic activities like dance can improve your health, your heart health, and your mental health. Various recently published studies have examined that physiological and psychological benefits of different types of dance and the effect on different populations. This includes children, adolescents, adults, and even medically compromised populations. One particular systematic literature review found that Latin dance has been demonstrated to promote physical health by helping people lose weight, improve cardiovascular health, increase muscle strength and tone, and improve flexibility and balance. Also, the study found that Latin dance can benefit mental health as well by reducing stress, improving mood, social connection, and cognitive function. And the study concluded that these findings from that research provides substantial evidence that Latin dance has an effect on physical and mental health, and it has the potential to be a powerful and wonderful public health intervention. Studies in general also have found that people who are more socially connected can live longer. So social connection, connecting with others, is important in protecting you risk of heart disease and mental health issues, protecting you against your chance of a heart attack, stroke, and it can improve your mental well-being. There's so many different ways to get started, whether it's signing up for a class at your local community center or even following along to free classes here on YouTube. So sign up for a local dance class, meet up with your friends for a dance party, or just have a dance party in your house. Please let me know what you think below in the comments, or let me know if you have any questions too. If you like this video and are interested in more videos on dance and health topics, please subscribe. Until next time, thanks for watching. Bye.